Welcome to the GI Fellowship Program at Carolinas Medical Center in Charlotte, North Carolina. Our 3-year clinically focused training program draws on the wealth of clinical material from the Tertiary Care Center, Carolinas Medical Center. Carolinas Medical Center is an 874-bed tertiary care center and the core component of Atrium Health, a non-for-profit, multifaceted, vertically integrated healthcare system. As the largest healthcare system in the Carolinas, Atrium Health offers a wide variety of health and human services to residents of both North and South Carolina. The training program offers exposure to a large volume of general GI cases and subspecialties in GI, including motility, inflammatory bowel disease, and transplant hepatology, with faculty specializing in these areas. We are a regional referral resource for Western North Carolina and Northwestern South Carolina. Fellows will have access to the latest literature through the Medical Center Library and educational material from various GI organizations. Carolinas Medical Center has a clinical data warehouse and a biostatistics core to assist in analysis. The program also has access to a dedicated lecture space. Didactics include a weekly conference where lecturers review key topics over the 3 years of training. There's a weekly clinical case conference and a monthly journal club. There is also a monthly pathology conference. Subspecialties including IBD, motility, and hepatology also have conferences. The fellows have a dedicated office space, and they also receive an annual CME allowance that allows each fellow to attend one of the annual society meetings each year. The medical record software is currently Cerner Canopy, and we are transitioning to Epic in 2021 to 2022. The endoscopy unit has 3 general procedure rooms, 2 ERCP rooms, and 1 EUS room. Endoscopy reporting is done in Provation. Fellows can expect to do about 290 procedures a month, including 130 upper endoscopies and 90 colonoscopies. The inpatient services are divided into a luminal GI inpatient service, where patients are seen as consults, and an independent hepatology service where a limited number of patients are directly admitted to hepatology, and the majority are seen as consults. There are outpatient rotations in endoscopy, motility, IBD, and hepatology. Third-year fellows will perform outpatient endoscopies at the local VA 1 day a week. There are opportunities to tailor one's last year of training to accommodate interests such as motility, nutrition, or transplant hepatology. Now, we'd like to introduce a current fellow to hear what they think about our program.
Fellow candidates, I'm Milan Patel. I'm one of the second-year fellows. First and foremost, congratulations to each of you guys for landing this interview spot. I know it's a very stressful but exciting time as you guys embark on your interview trail. So we have a very strong and well-rounded program here. Through the 3 years that you'd be a fellow here, you'll spend 6 months of that dedicated to IBD, 6 months on motility, 6 months on advanced GI, and we are a transplant center, so you'll spend 6 months of that on the transplant liver service. By the time the fellows leave here, they feel very comfortable and confident taking care of all these type of patients in their practice. We get lots of volume for endoscopy, so from day one, you'll start with EGDs and colonoscopies. We work with many different attendings, many of them working in the private sector, and so you get a different flavor of how things are done in endoscopy, everyone's different techniques and whatnot, which I think is a great advantage as well. We have plenty of research if you're interested in that, in the motility department, IBD, liver, there's pancreas projects going on. So whatever your interests are, it's available for you. It's easy to get very involved if that's your interest. And lastly, the city of Charlotte's amazing. There's a lot to do here. If you're single, if you have kids, if you're married, there's theme parks, water parks, bars, restaurants, breweries. I know it's all shut down right now, but eventually it will open up, and there's just plenty to do here. It's a rapidly growing city. I wouldn't want to be anywhere else. So I know that was a short little intro. I think we are going to meet you guys virtually on your interview day, so we'll be happy to answer any questions from a fellow's perspective on that day. But until then, good luck with everything. Good luck with your other interviews on your trail, and I look forward to meeting you guys virtually on your interview days.
We'd also like to introduce you to some graduated fellows to hear what they thought about our program as well.
Hi, my name is Dr. Narang. I started my GI fellowship in 2010. It finished in 2013, so I guess you can call me the guinea pig fellow because I was the first fellow of Carolinas Medical Center program. A little bit of background, I moved from New York in 2009 and did my transplant hepatology year that finished in 2010. And then the GI program was opening up here. Dr. Scobie approached me with the details, and it sounded really exciting. I interviewed at a few other programs, but clearly Charlotte was the right place for me as a fellow, and our family loved it. My wife and kids were happy here, so we really didn't want to move again. And fast forward 7 years, it's now 2020. It was clearly the right decision for me. I would do it all over again if I had to. Some of the strengths about the program, it's a great program, great opportunities for conferences, research. The educational experience for me was wonderful. Having a hepatology program, having a colorectal surgery program, having a hepatobiliary surgical program. There's multiple residents, fellows, medical students that are involved in the hospital, so really good teaching experience as well. Great opportunity to do research, to participate in conferences, so I thought it was really well-rounded program, and I've had a great experience. I am now a therapeutic gastroenterologist, so I do general GI and I do therapeutic endoscopy, so EUS and ERCP, and clearly the program has prepared me very well for what I'm doing now in private practice. So it's been a great experience. Sorry you guys can't physically be here because of the pandemic, but wish you all the best for your interview. If you have any questions, again, my name is Tarun Narang. My direct cell phone number is 704-607-0307. If you have any questions, please feel free to give me a call. Have a great day and all the best.
Hi everyone, my name is Lindsay Spence, a graduate of the CMC GI Fellowship Program in 2020. Unfortunately, we're not able to be together today, but I did want to take the opportunity to share with you some of my experiences at CMC. First of all, I want to tell you about the pathology that we see in the department. I think for a blended program with community and academic affiliation, we have excellent pathology. The size of Charlotte means that we're going to see everything walk through the door, from new diagnosis IBD, new oncologic diagnoses, as well as infectious etiologies, and also our oncology department does a lot of work with immunotherapy, so immunotherapy-induced colitis is something that we see quite often as well. Our procedural volume is excellent. I had more than adequate training and exposure to a multitude of procedures throughout my first, second, and third years. I think that I come out of training knowing full and well that I'm going to be a superb gastroenterologist with excellent procedural skills. We also have great subspecialty exposure, namely in inflammatory bowel disease. We have two attendings who are experts in their field. And of course, Dr. Moshri and the motility department is really excellent resource where we are able to get hands-on exposure to motility testing, procedures like EndoFlip, really anything that you're interested in, you can gain more exposure into. And with the addition of Dr. Jason Baker to our motility program, I expect that program is going to continue in its excellence. We do have also excellent personal support. For me personally, my interest was in blending the intersection of gastroenterology and nutrition. So I'm actually actively enrolled in the Masters of Public Health with a focus in nutrition at UNC, which Dr. Zaks and the entire GI department supported me in. And I was actually enrolled in that during my third year of GI fellowship. I was able to use some of that training in my interactions with patients, and I actually did an away rotation as well at Duke in the intestinal failure clinic. So I think the program supports your personal interests. Of course, in-house we have a multitude of avenues to pursue your own exposure. If you're interested in advanced gastroenterology, we have the in-house fellowship. We also have amazing exposure to our attendings. Being a smaller program, we can call them on a regular basis to ask questions, or if you're interested in those procedures, the doors in my experience have always been open. But also if there's something outside of the field that's not in the hospital, the program more than goes beyond in their support to encourage you to seek that out as well. A little bit about the attendings. I can't say enough about the collegial environment at CMC. I think that the attendings really firstly have the patient's interest at heart, and then a close second would be the fellows. They take great care of us. They actively ask us how we're doing, making sure that we not only have great procedural exposure, but also the academic training behind it, from putting on a pathology conference with the pathologists, or the morning conferences every morning on Mondays and then Thursday afternoons. I really think that you come away from the fellowship with an excellent training, but also a respect for those around you in the environment, from nurses to nurse practitioners and APPs. Really, there's a collegial environment that I don't think that is matched other places. I come away from the fellowship ready to start my career. I feel more than comfortable with my procedural skills, and I feel excellently prepared in my academic knowledge as well. We're excited that you're interested at CMC. Feel free to reach out to us or anyone else if you have further questions with that. But best of luck in your journey, and please consider CMC. I really think it would be a great home.
Hi, I'm Kevin Humphreys. I finished up the fellowship program here at CMC in 2018. This obviously is a weird interview year for all of you guys. So one idea was Dr. Zach's had was have some of the CMC alums talk about the training. So this is pretty cool. So I'm in practice down in Palm Harbor, Florida, where I grew up. And definitely feel very fortunate to have done the training at CMC, 2 years in private practice now. Highlights for me would be the endoscopy teaching, especially from all the faculty, but the advanced endoscopy folks. I don't do any advanced endoscopy, but certainly learning from Dr. Dries, Dr. Lewis, and Dr. Chauhan, who you guys will probably meet on the interview day. I couldn't think of a better group to learn from. This is coming from a guy, myself, who's very slow to learn endoscopy, definitely not a natural endoscopist. But in the 3 years at CMC, you'll get really good training, plenty of volume. I think especially in the third year, even if you're not pursuing advanced endoscopy procedures, which I certainly wasn't, working with those guys really helps. And now, endoscopy used to be something I almost feared. I love it now, and my outpatient days are my best days, and I think I owe it a lot to those guys. All the faculty, they were always supportive, gave me tough love when I needed it, and I really appreciate it. I think the other people, you'll talk to Lindsay, Brittany, and even Dr. Narang, who's the original fellow at CMC, they were all more natural. Dr. Narang, I think, was doing colonoscopies faster than I was in his first week than me in my first year. But it's really good endoscopy training. On the exact opposite side, more the cognitive part of GI, inflammatory bowel disease and the liver disease stuff is, I think, very strong at CMC. It's a unique community program in that it's a robust liver transplant center, and I'm really grateful for that training. I think if in a second life, I'd probably be a hepatologist. And the training, though, to this day, I do a lot of inpatient work in my current practice. So I probably call transplant hepatology at Tampa General, our tertiary center, like once or twice a month about transferring a patient. And actually today I just did. And it's rare another doctor tells someone they're doing a good job, but the transplant hepatologist said I gave a good presentation. So I owe that to Dr. Russo, Dr. DeLemos, Dr. Smeltzer, and Dr. Zamor. I think the liver training here is probably above and beyond what you'll get even at some of the academic places. You do a lot of liver, at least when I was a fellow. I liked it, so those are some of my favorite months. And you'll learn a lot. You'll learn a lot from the surgeons you work with and the hepatologists. The third point I would make that I kind of, to this day, is probably the best part of the program is how collegial it is. So you probably will talk to Brittany, or she's going to have a video, and then my co-fellow Madeline not do a video. I guess they can only handle one of us from the 2018 class. But I text Brittany and Madeline pretty much every other day. Certainly when Madeline and I were both in our first year of practice, we would ask Brittany to ask for us questions about difficult patients during the case conference. So pro tip, stay really close with the people the year below you. So when you're your first year in practice, you can ask them to ask the faculty questions. But that's just the environment that I think the attendings created. It's a good mix of attendings. Some of them have been in private practice. Some of them have been in big health systems. Some have been in academics. And it's very supportive. They talk about cases, and that's something that I think all of us still have carried on. I wouldn't hesitate to call up Dr. Russo with a liver question, or Dr. Hansen, or one of our inflammatory bowel disease attendings. I texted him not just months ago about questions. So I think that's a pretty special place when your attendings are still available for you, and even more important, your co-fellows are there to support you even when you finish. So I can't think of a better program. This training program was great for me. The faculty were really patient. They care about your learning, and it's honestly a really fun place. It's too bad you guys don't get to visit Charlotte. I've been in North Carolina for a while, but it's definitely my favorite place. A little mix of a big city with still some southern charm, and a lot of young people, so it's a pretty cool place. Dr. Zach's provide you my contact information, especially anyone from Florida or anything wants to reach out. But best of luck on the interview trail. I think if you choose to come here, you certainly will be very happy. Thank you guys for giving me a chance to talk. Good luck.
Hey applicants, my name is Eric Hilgenfeldt. I'm one of the recently graduated fellows. I think the CMC program you're applying to is a truly special one. I know that I was attracted to it initially because it was very strong clinically. You got early exposure to endoscopy, which I think is important because it allows you to have a connection to your patients, and it makes you want to learn more about them by the very fact that you know that you'll be the one performing any of their needed procedures and treatments. I think the quality of the faculty are second to none. Each of them has their own specialty, and together learning a little bit from all of them goes into making you an incredibly well-rounded GI physician. This program also, of course, has an advanced year. They have a liver transplant program. We have motility that is a very strong center of our education. We have incredible IBD specialists. I'm sure all of these will be explained to you over the course of this video, but the importance is just knowing that if you come here, you will have a wonderful experience with a close-knit group of attendings and a close-knit group of fellows. Additionally, I think the hospital system that we work for does a really good job at making sure that our fellows have the right environment to learn in. And again, if you have any questions, you're more than welcome to reach out to me via email, and I'll be happy to respond to anything you may think about, okay? So good luck. Again, good choice with applying to CMC, and might be interacting in the future.
Hi, my name is Brittany Seminara. I am a 2019 graduate of the CMC Gastroenterology Fellowship at CMC Maine. It's a facility of Atrium Health. I wanted to share some of the unique characteristics that CMC Gastroenterology program can offer. I am 1 year out into private practice, so I think I might be the closest to let you know how I felt I was prepared. CMC's program is unique in many ways. One, it's a small program, but it's very busy. From day one, you are learning how to scope. That is something that you don't get trained in residency. You don't come in with those qualifications or those skills. So it's nice that on day one, they put a scope in your hands. And I can tell you, I was talking to my colleagues from other programs, I had many more procedures under my belt within the first 3 months than they had. And I can tell you confidently that I came out with the ability and the confidence to keep up with my colleagues of many years doing full days in outpatient endoscopy. I think that's very important when you come out and you're in a private practice or you're in a new ambulatory center. They want you to be ready to have a full day of endoscopy. I think a lot of new fellows maybe aren't as prepared, but I felt more than capable, and I was more than capable my first day, my first week, my first month to keep up with everyone. Something else that CMC Maine's gastroenterology program stands out above the rest is the amount of time that you get to spend with transplant hepatology. We are blessed in the fact that we have a very robust transplant hepatology program. Many other programs don't have very much exposure to liver, let alone liver transplant. I feel very confident in an outpatient setting to take care of liver disease from just an elevated liver enzyme workup all the way to the most complicated post-transplant care. I think also one more thing that I would highlight about a wonderful attribute of the CMC program is the fact that you work so closely with the private GIs. You get exposure from day one with private gastroenterologists, academic gastroenterologists, advanced gastroenterologists, transplant hepatologists. So you get to see throughout your 3 years what would be the best fit for your career path. Going into fellowship, I did not know what I wanted to be when I graduated, but I had enough exposure to each one to see the everyday, the ins and outs, and the pros and cons of each career choice that I could make. So with that, good luck on your fellowship search. I know these times are a bit crazy. I'm happy to answer any questions you may have. I'm sure Dr. Zachs would be, he pass along my contact information. Once again, Brittany Seminara. I'm a 2019 graduate of the Gastroenterology Fellowship Program at CMC Maine. Good luck.